next up, we have very, very much coincidentally, by the way, this is not something we master planned out here. One of Seven Wire's partners in a lot of investments and a lot of work in helping really improve the national health ecosystem, the global health ecosystem, and when it comes to co-investing in different digital and digital health assets, is General Catalyst, and someone who is a leader there as an executive in residence, and just another great opportunity for our community to get extraordinary insights on what is actually driving today's funding environment. And we're going to talk today with Stephen Klasko about investing in innovation, and from his perspective, what kind of strategies for growth in health tech, wearables, and AI are leading the way at General Catalyst and healthcare in general. Hi, Stephen. How are you? Thanks for joining today.
It's great to be with you today. Thanks.
Yeah, it really is amazing. The work that you've done, your career, just looking through your LinkedIn page, is extraordinary. And for the audience who wants to take a look at Stephen's LinkedIn, please do. It's in the chat. And again, would love to have you describe a little bit about what an executive in residence at General Catalyst, one of the world's leading venture funds and certainly one of the biggest in digital healthcare, does when you support the firm's focus on early stage growth investments in health tech.
Yeah, so I've spent 40 years as CEO and leader in the most risk-averse sector of the world, which is large academic medical centers. Most recently, I was president and CEO of Thomas Jefferson University and Jefferson Health. And we tried to differentiate ourselves. We basically said we're going to be a 200-year-old academic medical center thinking like a startup company. And through that, that's where I met Hemant Taneja. And in 2020, we wrote a book called On Healthcare, a Manifesto for Health Assurance. And in essence, what it came down to is that Hemant said, we don't want to just talk about this stuff, and we don't want to just invest in companies that are creating point solutions. We want to be a catalyst to really create health assurance, healthcare at any address in this country. So after 9 years, I left Jeff and basically worked with Hemant and in the companies that are really creating platforms. And I'll just give you just a couple examples that just get me incredibly excited. So some of it is where healthcare is out of reach. So if you think about companies like CityBlock, that are going after the most underserved population. There's a company, Equip, which is going after folks with eating disorders. I'm involved with a company, Genial, which is going after folks with neurodiversity. Those are literally the kind of things that people say, well, you can't really, transform that, number one. And if you do, that's never going to get investment. Well, clearly they are. And then very involved with something that really started at Jefferson called Strongline. We spent 40 years, in essence, lying to doctors and nurses that technology would make their life easier, starting with the EHRs, the epidemic. And, and now we're actually creating some of those things that will do that. So Strongline is a model for nurses that if they're feeling insecure, has a GPS-enabled device that actually helps them. Comure is another platform that's doing that. So I think the real sort of headline is going from point solutions to platforms, because health system CEOs are tired of having to put all the Lego pieces. I used to have 100 people pitch me a month, and they were great companies, but I said, well, I'd have to spend all the time saying, if I put this together and this together and this together and this together in women's health, maybe I'd have a company. But clearly, I think what we're starting to see, at least at GC, is partnering with health systems and seeing what they need.
That is so true. And if you look at what Seven Wire and General Catalyst did when they built up Livongo, they moved from Livongo as a wireless glucometer that was a point solution to turning it into a wellness platform and an actual platform entirely. So that was a great story, just in looking at a point solution and moving it to a platform over the course of that 10-year period.
Yeah, the genius of Livongo, and what I spend most of my time thinking about is 97% of people in the United States of America don't want to wake up in the morning and think they're a patient. They want to be a person who can thrive without healthcare getting away. So, you know, we were one of the initial partners of Livongo, and the concept was, hey, Steve, you do a great job if a patient needs an office, needs an urgent care center, needs an emergency room, needs a hospital. That's not how they want to wake up. So how about if I'm their invisible friend in diabetes, and then I'll send them to you when you need that. That's really where healthcare has to go. If you came to my office when I was CEO of Jeff, I had this big sign that I hope 5 years from now, when Elon Musk brings people from Mars to Philadelphia, and they say, "Where's Jefferson?" You can't define that. Do you mean Jefferson on my phone, or Jefferson partnering with Livongo, or Jefferson partnering with Comure, or Jefferson at home? Oh, you mean the place where really, 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 really sick people go? I think that's still a 10th of Walnut. So we don't call ourselves hospital systems anymore. We call ourselves health systems, but we define ourselves by where we fail to keep people healthy. So I think what General Catalyst is doing, and you've probably read that they're also acquiring a health system, Summa Health, to prove that they can do that. But what they're doing with our partners, and Jefferson was one of them, is really not just saying, here's 180 companies that we've invested in, but here's how we can work together to transform healthcare on behalf of your patients.
That's it. That's so on the mark, and I think the audience here today really is going to appreciate that. And tell us a little bit about what some of the big factors are that you consider when you're evaluating an asset in health tech startups, and particularly when we look at what the theme is today, which is wearables, AI, and other emerging technologies. What are you looking at? What kind of factors do you look at?
Yeah, I've gotten very involved in the wearable space, and I think look, I mean, I start off with this premise. My car gets better care than I do, because literally my car is sending seamless 24/7 information. And when I get back home to Miami, my car's going to say, "Hey, Steve, while you were away, my right front passenger tire got a little low. Could you fill it up?" Meanwhile, I'm going to have a physical exam 2 weeks from now, and my doctor's going to tell me what my calcium score is, what my blood pressure is, what my labs are, and this is what I should do for the next 18 months. We have no idea what I should do for the next 18 months as a 70-year-old, right? So I think where we will move, I think what we'll look at is the wearables today. I worked with Apple in their first digital health piece. It'll be looked at as the first iPod compared to the iPhone. So I think what we're developing, and I'm involved in some of them. The former CEO of Jawbone has created something, for example, where we'll continue to send seamless data 24/7. And then the question is, how do you make that actionable? How do you make sure that the patient is getting the right information? And more of it will be at home. I'm an obstetrician. I was involved in a company that was allowing people to get electronic fetal monitoring at home. Well, that's a game changer, because underserved folks can't get to the hospital 3 times a week to get non-stress tests, so they end up literally having premature labor, et cetera. So I think the whole concept of bringing the rest of the consumer world into healthcare through wearables and through at-home type devices, more than just the RPMs that exist today, will really be probably the biggest change that we'll see in the next 3 to 4 years.
It's incredible, and that's what we're seeing as well. And so when you take a look at the metrics that companies are using, and we'll wrap up on this question, but what metrics and indicators are you using to understand how successful your investments in digital health companies have been, and whether they're aligning with General Catalyst's overall investment goals?
Yeah, well, General Catalyst Investment Committee obviously has some very, very, very well thought out analytics as to those things. But I think what's critical about GC and the responsible innovation piece is, frankly, also making sure that we're making a difference, that we're following the tenets of the book that we wrote, and that the companies that we're doing together in toto are literally getting into the concept of social determinants, predictive analytics, population health, and that kind of thing. So literally, I think one of the things that differentiates GC is that sort of bringing together those disparate companies into an ecosystem and creating its own ecosystem. And I think that's what's behind Health Assurance Partners. The 20 health systems that have decided to partner with us is about almost 18% or even a little bit more of every patient is part of a health assurance partner. And then the most recent thing that Mark Harrison is running with HATCO around actually acquiring an IDN and sort of taking that next step, improving that we're not point solutions, that we're really creating platforms to make doctors, nurses, and patients' lives improved.
That's phenomenal. Well, again, thank you so much for joining us today, and looking forward to having you back on the program. It's just these insights are tremendously helpful to our community to better understand whether they should be working with General Catalyst and if it's a good fit, and they really do need that kind of guidance, especially in today's rigorous funding environment. So thank you for joining us today.
And thanks, Dan, for everything you folks do at HIT.
Thank you. Take care.